The Ugandan Health Ministry says the death toll from an Ebola outbreak has risen to at least 9. This comes only 2 weeks after the authorities announced an epidemic in the center of the country. In Sudan, authorities have quarantined refugees at Al-Tuneba camp in the east of the country after 3 cases of monkeypox were detected, raising the countrywide tally to at least 17. For more insight, I spoke with Donal Bisanzio, senior epidemiologist at the Global Health Division of the International Development Group, RTI International.
Here what we have is that we cannot protect population, but then all the activities, the intervention that they are performing right now, testing, contact tracing, isolation, is really what any country should do when they have an outbreak of Ebola. And Uganda is doing this in a very well way in the area where Ebola was reported, but also in the surrounding area, because people, they move, they can bring the virus in other places. So they should kind of create like a buffer around these areas and then protect the health workers too.
What can be done to prevent this disease to continue to reemerge?
We really need to, kind of share, inform people that when they are in contact with animals, they can be a reservoir of Ebola. So that can be a risky type of contact. And usually outbreaks start with a spillover from the wild. So we should start to tell people just to be more careful when they do hunting and so on.
Is it always about bushmeat though? Are there other possibilities for such a disease to occur?
If we think about country, it can be also imported cases from other countries. So without really the contact with the reservoir, I'm not expecting to see any outbreak of Ebola. And then when you look at the last outbreaks and you trace back, you always see that trace back to an imported cases or someone that got in contact with some reservoir in the wild.
Now, let's talk about another zoonotic disease, which is monkeypox. Sudan is tackling an outbreak of monkeypox currently.
The outbreak of monkeypox in Sudan, so since it started from a student, then, got in contact with other people and so on, but still everything is ongoing. So the investigation is ongoing. Something that really is very concerning for me is that there are 3 cases of monkeypox in Ethiopian refugee camp. They now got isolated. So, and that is something that can become, a very big health emergency, because we know, people in the refugee camps, they live in not very good conditions and so on. Plus, right now there are 7 cases that they are even in the capital and in other places. So, and I'm expecting to see more cases coming. So Sudan is also kind of destroyed type of health system. Sudan gets some help, but then the point is we really need to have contact tracing again, and then isolation, and then give information. Information is also the key.
How do we fight monkeypox in Africa without the vaccine?
The only way that we have right now, so every single time that we have an outbreak, contact tracing, isolation, and then information. Those are the 3 key interventions. And I hope that the vaccine situation will change, because it's not fair for Africa not to be in the share of the vaccine. So that is something that we need to fix, really.
For a country like Sudan, in a context with limited resources and a strained health system, what should be the priority at this stage to contain the outbreak, to prevent it from spreading further?
The priority should be to get a vaccine, of course. That should be the first, because vaccines is cheap, prevent the spread, and then prevent also having people going to hospital or, getting home and infect other people. But without that, so we really need to increase, the strength of the health system, but also providing these contact tracing and isolation.
When you look at monkeypox in Sudan, Ebola in Uganda, and other outbreaks that are zoonoses, what does it say about the future of public health?
We really need to create a kind of system that can be useful to respond swiftly to these type of events. So they are getting more and more common than before. Now, the destruction of the forest, of the wild habitat, is also pushing these animals to get more in contact with us. Destroying this habitat is also pushing the animals to find, food and so on in our cities, and then is going to, increase these type of events because now we are more in contact with them.